I'm just going to give a quick overview a bit about SAIL and how we've used it in musculoskeletal care and mapping for better care. So SERP UK is the infrastructure used, and that also holds a dementia platform, the MS Register, Datamine, UK LLC, among other things. And one of the other clients of UK SERP is the SAIL Data Bank. So the SAIL Data Bank is basically electronic data for people living in Wales. And with that, we have, for example, the census for 2011, 2021 that can be linked to all the other data sets. So we've got a good demographics on the people living in Wales, and that can be linked, for example, with the GP data, the hospital inpatients. I do quite a lot on child health, so looking at how, for example, looked after children interact with different services, so their schools, their hospital, GP, A&E visits, what happens before they get taken into care, what happens after. The primary school surveys is almost the opposite of what goes on in the UK LLC, where we do surveys with people to add them to the electronic data, so to enhance the depth of the data. So, for example, we've got about 60,000 children who have contributed to add within all the electronic data, so you can get the depth there. So for people interested in basically SAIL, so the Welsh data, generally you access SAIL by having a scoping meeting, by talking about what the question is, and and whether the data can answer the question you're interested in. You have to have safe researcher training, so that's the ONS course, basically, where you do a course and there's a little exam at the end. You need to pass the exam, so you need safe researcher training. You need to have governance approval, and that takes about 3 months, and that's sort of the ethics approval for the question you're looking at. Then the data is provisioned, and after analysis, all the outputs need to be reviewed. So you need to do a data output request to make sure there's no small numbers and it meets the governance that you've got approval for. So that's how SAIL works. So an example of how it's been used in musculoskeletal conditions, so for example, is a sort of a Nuffield study looking at the priorities for people with musculoskeletal conditions, found that more than half had difficulty attending the services, so healthcare services, due to travel difficulties. And the travel issues and the services not being available locally was a much bigger problem for people living in rural areas. So in order to look at this and really look at it for the health boards, we linked the read codes from the GP to identify who had osteoarthritis, inflammatory arthritis, rare autoimmune conditions. We linked the Welsh Demographic Service to look at sort of socioeconomics, age, and the ONS rural urban classification in order to map where people lived. And you can see here for like osteoarthritis, you can see over here that the majority were urban females, but you can see the breakdown by age. We linked for hospital admissions to look at hip replacement, and we plotted travel times using GIS linkage times. So my clicking isn't working very well here. And rural dwellers with osteoarthritis were more likely than urban dwellers to have needed a hip replacement in 5 years following their diagnosis. And that was even after accounting for age, sex, and income. They were generally older when they lived in rural areas. And the travel times for most people in Wales, we're about 30 minutes to reach a rheumatology service, but about 22% of people didn't have a car. And the red bits on the map here, you can see that that they're more in the cities, that people don't have a car. Approximately 1 in 10 who didn't have access to rheumatology service, didn't have access to rheumatology service within 2 hours of a bus journey. And so you can see over here where there's lack of a bus service really, and that's more central Wales. And if you lived more than 60 minutes from a rheumatology service, the odds of you having a rheumatology outpatient appointment within the year was about half versus those who lived closer to rheumatology services. And people who lived further away from services were much more likely to have needed a hospital admission. So this is just, and although we were saying health professionals for people living in rural communities did see more people who had osteoarthritis. Once you adjust for age, deprivation, and gender, they're actually not at higher risk. They're pretty much at equal risk. So what this was adding up to, whenever you add together where people live, is that actually there's quite a bit of unintended consequences for centralising healthcare services, and that being aware of inadequate transport, so transport needs to keep up with if the healthcare services are being centralised, and that there are really pretty unique needs for people based on their location, let me see if this works now. Because I'm sharing my screen, I just want to see if can you see the story maps now?
We can see a website that you're...
Oh, brilliant.
Yeah, cool.
So basically, we were able to then provide, we go get maps. So the local health boards could go and look up for their local area the number of people. So for example, in this one, osteoarthritis, if you look at Howell, if you are from the local health board of Haldowell, you can see the prevalence of osteoarthritis in your area versus in neighbouring areas. And you can look at access to healthcare, so that we were able to produce maps that enabled people to see what things were like for their area, in order to start tailoring healthcare to the local context. So that's just to show a demonstration of using the linked data in order to improve service provision locally. We're also looking at improving service provision for children. So to be able to link school attendance, link children's demographic characteristics, whether they're a child under the care of social services, their health data. So for example, emergency department, their hospital admissions, their demographic, so what the GP knows about them, and being able to give those summaries to local authority and the health board to inform what service developments are needed locally for people. And so really, this is just to give an example of how linking the data locally, so in that way, I mean, within Wales here, or not in in one country, allows us to look at the pathways through services and improve really local provision for people.